Hi, I'm Dr. Sebastian Gonzalez with Performance Place Sports Care here in Huntington Beach. We are doing a small series on how to modify lifting and basically keeping strong while you still have an injury. One of the major factors problems that I see in regards to people coming in late beyond an injury is they've been afraid to continue lifting or strength training, or a lot of times they'll modify with cardio and so on, but a lot of times they become deconditioned, which is a whole other problem in regards to repairing from this condition. So we're going to go over 3 things in regards to lower back pain today that we can modify, and then you can probably add into a program if you talk to your sports med doc, if you talk to your strength coach. Everyone's case is very different, and this is going to be a very different video from the other ones because low back conditions can be a whole variety of things, and they don't always respond the same. So when I say these things, again, it's something you can bounce off your provider. So with low back conditions, again, we're not going to go through the pathology too much, just mainly some ideas. Something I found is really helpful is strengthening the posterior chain of the back and the hips and the hamstrings. So a Superman exercise is really good for that. I found a lot of YouTube videos on Superman, and I don't like them for a variety of reasons. We're going to show you the variety that I like, but it helps out strengthen the posterior spinal erectors, the glute max, the glute med, the hamstrings, if you do it correctly. Another one is the Deadbug exercise, which is very well published to help out with lower back conditions. But again, every condition won't respond well to it. Sometimes it'll flare people up, and sometimes because they're doing it incorrectly. Now, today's is not about nitpicking on form. I want you to realize that it's more about just putting the idea out there, and then you go somewhere where they would teach you how to do it exactly. The Deadbug has many progressions of it, but it's when you're on your back and you're moving the extremities while having complete core control. So mainly more of a dynamic stabilization of the trunk. Last one is deadlifting, because I know deadlifting is very taboo in regards to back conditions, and some back conditions are terrible to deadlift with, I think. But there's studies that show that deadlifting is very beneficial with back pain, especially chronic low back pain. Now, there's certain risks you can take, and you're going to want to take, and there's other things you can do to decrease those risks. We're going to show you some things which decrease the risk, but I strongly urge, if you haven't had one-on-one training with deadlifting, you should. You very much should, because I know a handful of cases that have gotten worse, and you need to know exactly what you're doing, because even one bad rep can throw you for a loop. All right, a Superman is a great modification for getting some posterior chain with back conditions if it requires it. Now, one thing to consider, you can take a little rest here. Let me give an intro real fast. Depending upon the back pathology, it will take or very much hate extension or flexion patterns. So just keep that in mind. This is a very general recommendation for back conditions, because it can be many things. But this is usually what we try in the office, at least for modification of activity. Okay, go ahead. So this is our way of doing the Superman. Notice there's no extension of the spine. It's mainly, or not a ton of extension, it's mainly trying to keep it in an isometric single position hold straight as possible. I always tell people to push really far out with the fingertips and really far out with the toes, and they're basically hovering as low as they can towards the ground while keeping the same position. They can obviously take breaks. Mary, show me extension with the spine. So this is what I would not want people to do, because it might aggravate some conditions. So go ahead and come down and relax. And this is Superman. We usually hold for time. Okay, so the Deadbug is the next one, which I usually use as a modification. Again, these are things that you can use between other lifts. I mean, there's probably no reason you can't do some upper body stuff and really rehab your core and lower back area at the same time. So this is the Deadbug. There's many progressions of this. For the most part, we're going to start with the easiest. So she's going to go hands up, knees up. With this one, you want to keep your levers in mind. So bring your heel down towards the ground. One of them. So mainly doing the legs first. Notice that the knees are bent, so it keeps the lever really short on the legs, so it makes it really easy. She's making sure the back is pressed really firm against the ground, so it shouldn't be arching up at all. You can alternate arms and legs now. This is sometimes challenging for people just from thinking about. You can also do same side, There you go. So she got it. And the next one would be have the leg extended at the bottom. So make sure the knees are unlocked at the bottom. Go ahead and go down. There you go. So, and she can even go straighter than that too. So you'll notice that when people get straighter than that, they're going to start to increase their lordosis or their lower back curvature. So this one's is not about making you shredded. It's just mainly about functionality. So keep that in mind. This is something you do just productively with your time, break time from your other lifts. All right, and now deadlifting with lower back pain is really, really taboo, and it has there are a couple of conditions that I would not do it with, especially things of instability to the spine, spinal listhesis, slippage, and basically instabilities, like I said. So before you do any of this stuff, make sure you speak with your doc and make sure it's good for you. But there are studies which certainly validate it and say it improves lower back pain because of posterior chain development. So what we're going to show you is a variation here of, we're going off of blocks that you see. This is our style of blocks. We just use other plates, mainly because sometimes lower the position, their form falls apart. So there's a couple things we can do from blocks. So go ahead and give me, Marielle's going to give me some straight-legged deadlift, mainly so you can see variation. I don't like stiff-legged that much, personally. And we're going to look at her knee angle on this. Notice that when we get to the bottom, her knees are going to be fairly straight, but her back's still flat, so she's got some good form. Now, I would say that people that they're doing these with less knee bend have a higher potential of injury than the ones who bend the knees a little bit more, mainly because their flexibility, that person's independent flexibility. So to decrease risk, a lot of times we ask people to do more of an RDL, so give me some more knee bend. She still has a butt significantly higher than the knees, so she's still going to get a lot of posterior chain activation. Notice that the spine is straight. Now give me a little bit more butt dip here. So technically a deadlift is anything where the knees are still below the butt. So this still counts, but some people who are not as flexible are going to take this much better. I think the worst thing you can do is throw someone into a position their body doesn't tolerate. So these are the variations that I typically use with people. Again, you might move from higher blocks as well, depending upon what they're feeling. So there's nothing wrong with going from a hang position as well. So this is something I would add, but be very, very, very cautious and make sure that they've talked to their doc first. Thanks for watching. I hope this was helpful. Again, this is all intended for educational purposes. Talk to your healthcare doc, talk to your sports med doc, or your strength coach about these ideas. These are things that I've found that work in my practice for a variety of people. But again, every case is very different. So if you want to get in contact with me or us over here at Performance Place in Huntington, it's p2sportscare.com. That'll take you to the right avenue. Or if you just want to learn more information, you can go on to our podcast on iTunes. It is Performance Place Sports Care. I think that's it. So like our videos, share our videos, and yeah, just keep learning. I think the more you learn, the more educated conversations you can have with your healthcare providers about your conditions, and I think they'll be able to let you do more stuff. Take care.